Hello, 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 Facebook. So we're going to try this one more time, and if it don't work this time, then I'm going to have to try again tomorrow. Hey, Mama. She opened her eyes right up. See how sleepy she is? She's sleepy, and she's fighting sleep. So we're going to try again. Sorry about that, y'all. When I went to go pick the phone back up, I accidentally hit in the video, which I didn't do on purpose, but I figured I would try to get her situated before I log back on. So she's chilling. Hopefully she just stays chill. So anyway, tonight I wanted to, thanks Carla, hello. Tonight I wanted to talk about the importance of the post-op course, like the things that happen after surgery, because I've had a few people that I've been trying to that I've had to have multiple conversations with about what they need to do post-op, specifically with liposuction. That's kind of liposuction is one of those situations where the result, you don't really get instant gratification in most cases. Every once in a while you'll get some of those lucky people whose results present themselves very early on and they look super good right away. But the majority of people, the average person getting liposuction, there is a progression to their results. Like they just get, hey Jessica, hey, they just get better and better over time, but they don't start off looking the way that they're going to look. So with liposuction, there is a lot of hand holding, and it's also sometimes hard to get some people to understand the importance of the things that they do after surgery. Liposuction, more than any of the procedures we do, you can really ruin the result. The patient can really ruin the result by being non-compliant. Like you can literally ruin it. A very important part of the liposuction result is post-operative compression. If you have liposuction and you don't compress afterwards, your body is going to swell from the trauma of the liposuction. It's a very traumatic procedure. Even though you can't see it from the outside, it's a lot of trauma that happens to your tissues on the inside. So you create a lot of fluid in order to heal it. It's just what happens. It's physiology. When you create that extra fluid, it stretches out your skin envelope. So you could technically end up looking bigger after liposuction than you look before the liposuction. If you swell a lot, it stretches the skin out, and so it can make you look bigger. And then if you don't adequately compress, then you'll heal in the swollen state. So the skin will be all stretched out. Your body will be laying down scar in the space where the fat used to be. And then people will be like, well, I feel like I don't look any different. And then they tell you that they haven't been wearing their garments. Sometimes they don't tell you, but you could just tell. So, like a lot of times they're not going to say nothing because they don't want to admit that they didn't do something. Or they really don't believe that the garment is really going to make a difference. When I tell you, those before and after pictures that I show where it's like, you look at the before and the after looks like a different person, that's a person who was relentless with their post-op care. They were wearing those garments 24/7. They were downsizing their garments as their body was shrinking. They were getting their lymphatic massages. They were being careful with their diet, not to gain weight, and being careful about their sodium and alcohol intake. They're doing all that stuff. That's how you get to the great result. And then you don't have to do that forever, but you need to do that until you finish healing so that you get the best outcome. You can't expect to get the best outcome if you're not doing your part. It's not just kind of like this passive thing where you just lay there and the surgeon does the work and then you get this phenomenal result with no effort on your part. You could totally ruin. Surgeon can do a perfect surgery, and if you go home and do everything that you're not supposed to do, you'll tear it all up. Period. So if you're not prepared to follow the instructions, don't get the surgery. How long does it take to heal? That's a good question. So that is actually not the same for everybody. So I had one lady that came in this week for her 90-day follow-up, and most people 90 days is an adequate amount of time to be in the compression. And if the person's been wearing their compression at 90 days, usually you can't look and see visible swelling still. But this person, I looked at her and I'm like, you're still swollen. Sorry, boo, you got to put the garment back on. But it's 90 days. And I'm sitting there like, but you're still swollen. So apparently your body didn't read the textbooks, and so it doesn't care about the 90-day rule. It's like, yeah, I need more time. Everybody's not the same. And I've used this analogy before. If when you go get your hair done, if you, like, remember back in the day when people got wraps? Or even with a sew-in, like you get your hair washed, shampooed, sorry, my mother would be so mad if she heard me say wash. You don't wash hair, you shampoo hair, you wash clothes. So you get your hair shampooed, and let's say you're getting a wrap, and then they wrap your hair up and put you under the dryer so it can dry, and then they put you under there for an hour or something. And then at an hour, the dryer stops. You flip the hood up, or if you got your sew-in and you're washing and you're shampooing it, and they put you under the dryer and set it for an hour, and at an hour you lift the hood up, and you put your fingers in your head, and you're like, ooh, it's still wet under there. But the dryer cut off, so I'm just going to sit here. But your hair's still wet. So when she comes to comb your wrap down and flat iron it or whatever she gonna do to style it, if it's still wet, guess what? She gonna be like, girl, why are you sitting here with the dryer up when your hair's still wet? I can't do nothing to your head and it's still wet. That's the equivalent of saying that you're still swollen at 3 months and saying, well, it's been 3 months, so I'm not gonna put the garment back on. If your body is still showing signs that it's not done, you gotta put it back on. You spent the money, you spent the time, the effort. Like, don't waste it acting like you don't understand. If you see, and maybe you can't tell, like, oh, I'm just swollen. But if you see that you look great today, and then on Thursday, like, well, today is Thursday. Okay, let's say you look great today, and then on Sunday, all of a sudden it looks like your result is gone. That's swelling. Because I don't care how much you eat in 3 days, you can't change the whole outcome of your result. From weight, you're not going to have that much fat on you in 3 days. So that tells you that it's swelling. If you look great on Thursday and you look crazy on Sunday, you're swollen. Put the garment back on. Put the garment back on. Sometimes you'll be like, why am I so swollen? And then I've had patients. They're like, I don't understand why I'm so swollen. I don't understand. I'm like, well, what you eat last night? Red Lobster, Mexican, or something that you know is full of salt. That's why you're swollen so much today. Like, all of that stuff affects you. And when you're trying to heal lipo and shrink, when you're trying to make your skin shrink and everything stick back down in the smaller size and remold into a new shape, you need to keep all that stuff under control. And the garments help keep that stuff under control. So you can't come out of the garment and then be saying, well, I don't think I got much result. Well, if 3 or 4 liters of fat came out of you and your result went away, you did something. Period. That's it. So you have to do your part. When my clients work out, I just have them wearing their compression garments. They have to be in their compression garments 24/7. So if you're working out, you just need to be in your garment. That's it. Your underarms, that's not I won't liposuction in somebody's actual armpit because it's too many lymph vessels in there and you can make problems doing that. So I personally won't do that. I don't ever have my patients wear Spanx. I don't think Spanx is really strong enough if you're doing the lipo thing. So Lipo 369. Oh, Lipo 360. I'm like, 369? I ain't never heard of that one. Where the other 9 degrees at? Lipo 360 is the same as any lipo. You're going to be, my patients are in compression for at least 3 months. I literally say at least 3 months now because some people need it longer. And then when you come out of it, like I said, if you look up a month later and you're like, where's my result? It's probably swelling. Put the garment back on. Yeah, so I did a video about this a while ago, Shamika, where people are saying some of their doctors don't recommend garments. Look, I'm going to ultimately tell you to do what your doctor tells you to do. I'm never going to be like, well, listen to me. If you went to somebody else, do what they tell you to do. But if they're telling you to do wacky stuff, you should have figured that out before you got to surgery. Physiology doesn't change. I don't care who your doctor is, what their name is, or how many followers they have on Instagram. It's physiology. If you don't compress after liposuction, you're going to have a hot ass mess. And that's the end of that. So you should find out if they got some strange, I'm talking about liposuction specifically. I'm not talking about tummy tucks and stuff like that, because there's some tummy tucks that I don't put them in a compression garment until later. Like it might be a week or two later before I put them in a compression garment. Tummy tucks are a lot more vulnerable to over compression, and you can really hurt the person by compressing them too soon. So I'm not talking about tummy tucks. I'm talking about liposuction. And then also with lipo, if a doctor is telling you don't wear the compression garment after lipo, well, if they did some really aggressive lipo and your skin looks like it's barely hanging on, then they'll tell you come out the garment. So then that's why I say you can't be making your own decisions on what to do post-operatively based on my videos. You need to listen to your doctor, because if they went and did something super aggressive that I don't know about and they tell you not to put on a garment, they're telling you that to keep your skin from dying. And, if your skin is really fragile from whatever work they did, and then you go and choke out the rest of the life of it with a faja, then that's a problem. That's why you need to listen to the person you chose to do your surgery, and hopefully they're leading you in the right direction. Yes, Carla, my patients do use foaming boards. Like, I give that to pretty much all of them. Tara, that's questions like that. Hey, mama, she's about to end the video again. Look, she looked drunk. Look at Mother Rose, y'all. She got bedhead. Ain't she so cute? Poor little munchkin. She had a rough day. What stage you're in, at what point, that's between you and the doctor. Like, you have to really go by what they tell you to do. Because like I said, the skin issue, like a lot of doctors do way more aggressive liposuction than what I do. And so if your skin is really vulnerable because of what they did and you go and choke it out with a garment, you need to just follow the instructions that your doctor lays out for you. Thank you. Thanks, y'all. What about with the brachioplasty? Brachioplasty, that's another one. Like, some of my colleagues have people put on compression sleeves, some don't. I have my patients put on compression sleeves. There's a lot of swelling with brachioplasties, a lot of swelling. And I just feel like it helps take some of the tension off the incision to control the swelling. And brachioplasty scars have a higher... Sorry, y'all. I haven't slept very much the last couple of days because this little mama's been up. Brachioplasty scars tend to have a higher likelihood to be wider, like from tension. So by compressing everything down, it keeps tension off of the incision so that I can heal more narrow and stuff. So, but you need to just do what your doctor tells you to do. Thanks, y'all. Yeah, Mila Rose is a big girl now. But what's aggressive lipo? Aggressive lipo is when the doctor takes out a whole lot of liposuction. Take a person, a whole lot of fat. Take a person from, one extreme to the other. And a lot of times to get there, when you take a person down a lot of sizes in one round, in order to get there, you have to really aggravate the blood supply. And so a lot of times when people get aggressive lipo, a lot of those really bad complications that might float through your timeline or you might come across in these surgery groups, like where they're like, oh, they got a liposuction burn or something like that. That's really usually from doing aggressive lipo and they've knocked out all the blood supply. to that skin, and so the skin dies, which is why I don't do that. Yes, Toya, you're a great patient. So are you, Lori. Any more questions, y'all? That was really what I wanted to talk about, because I've had, it happens the most with liposuction. People just decide that they don't want to do what you say. Like, I'll see them on Instagram wearing dresses with cutouts and they only 6 weeks out. I'm like, and those people always end up in my office trying to act like their result ain't good and trying to get me to do lipo for free afterwards, another round. I'm sitting there like, girl, you weren't wearing the garment. That doesn't mean I have to do your surgery 2 times because you neglected your part of the procedure. Like, you got to do what you're supposed to do. Period. If I suck it out, you have to do your part afterwards. Like, it's a group, it's a team approach. It's like I suck it out, then I tag team you, and it's on you now. Like, you got to do your part. Or come in and they're 20 pounds heavier and they're like, I don't think my results that good. Well, you gained 20 pounds, girl. Like, what do you expect? What can you put stuff on scars to minimize them? Oh, so I like things that have silicone in them. So there's different scar therapies, like, that you could even get over the counter. I think Scar Fade or Scar Away. It's like it's like a little silicone strip, and you can put it over the scars, and it'll help make them flatter and help with the color and all that kind of stuff. Are your patients awake when performing liposuction? Yes, usually. They have the option to be awake or asleep. I do the majority of my liposuction on patients is awake, though. There is a max amount of fat. I won't take more than 5 liters in one setting. I rarely take 5 liters, like very, very rarely. I can count on one hand and have fingers left over the number of times I've done that. But the amount I take out depends on the person. It depends on the size that they start. It depends on the number of areas I'm taking from. It depends on how much blood is in the aspirate. That's kind of the major stuff that it depends on. So it's definitely not like, people were like, well, how much fat are you going to take out? I can't tell you that because I don't know how your body's going to respond to me doing it. I don't know if you're going to lose a lot of blood with it or not. If a lot of blood is coming out with it, I'm not going to just fill up 3 canisters full of blood. That could kill you. So it does depend on the size of the person, the number of areas, and how much blood I see in the aspirate. The quickest time I've seen my patients recover from liposuction? And do you mean by recover, do you mean not be in the garment? Yes. No. Yeah, nobody's supposed to work for free. A PA can perform liposuction under the supervision of the physician. A physician assistant, can do almost anything with the physician with them. A cell saver is a way to the stuff that comes out of your body, like when we're doing surgery, like blood that you are losing. It's a way to get the red blood cells out and put them back into your body. A cell saver is not something that my patients ever would have to know about because I'm not going to exsanguinate any of my patients. A cell saver is something that they use in open heart surgery and vascular surgery where there's a tremendous amount of blood loss and it's a life-saving operation. And so you shouldn't be doing cosmetic surgery to the point where a person needs a cell saver. In my opinion, if you're routinely transfusing patients, cosmetic surgery patients, you routinely have to be giving them blood products and using cell savers. That, in my opinion, that's doing too much. You can start using the scar therapies at 3 weeks post-op, Jess. My liposuction, body contouring liposuction starts at $4,000. Do I send my clients on blood thinners? It depends on what surgery they're getting. It depends on their medical history. Every client doesn't get blood thinners. And none of my liposuction clients I've put on blood thinners. I'm in Georgia, Kimberly. I'm in Johns Creek, Georgia, which is a suburb outside of Atlanta. How long is swelling normal? Swelling, honestly, after, especially if you're with liposuction, swelling, even when I tell people they can come out of their garment in 3 months and they look good, and I'm like, okay, yes, you can come out of your garment, they will still have swelling come and go over the next year or so, like for up to a year after surgery. Tummy tucks, definitely, you can have swelling coming and going for a year. After a BBL, I allow my patients to sit after 3 weeks. Tummy tuck patients, I tell them to plan for 14 days off of work. Aw, congratulations, Deborah. After liposuction, out-of-state patients, if it's just lipo only, usually I'll let them go after 5 days. If you're getting a BBL, you need to be here for 2 weeks. I don't like virtual follow-ups for liposuction. I don't like virtual follow-ups for liposuction. So I make my patients agree to come back and see me at 4 weeks or 6 weeks at the latest. I prefer 4. Because pictures give you an idea of what's going on, but people always look very different in person than they do on pictures. And with liposuction, so much of your outcome is reliant on your compression and stuff afterwards. So I like to see people at the 4-week mark, no later than 6 weeks after their liposuction, to ensure that the garment is hitting in the right places. You're not creating creases where you don't need it. The garment is tight enough. Check what the skin is looking like, and I can't really do that or appreciate that stuff virtually. So I really don't. I get upset when people like stand me up on their follow-up appointments when they come from out of town. Like, I really like people to commit to coming at least once. You can fly in and fly right back out the same day. But with liposuction, I can't guarantee your result if you don't come back. That's on you. So you can't show up a year later like, well, it didn't really come out like I wanted to. I feel like I didn't get enough result. If you didn't come back for a follow-up, that's your fault. My Instagram name is Dr. Myla. That's it, DrMyla. I don't accept insurance. My consultation fee is $150. I don't do revision surgeries for free. So depending on what, if somebody needs something else done, like to be taken back to the OR, then they usually have to pay something, usually. Thank you, Carla. You gotta come back. How long ago for brachioplasty? Probably about 2 weeks. The brachioplasty, it's like, I don't want people to, I guess maybe you could go back after a week. It depends on how big the brachioplasty was and how tense the incisions were, and if I had to go up into your armpit to close it. It's kind of a few variables. I guess the safe answer is to say 14 days, but if yours is a really simple, straightforward one and the incision's not going up too far into your armpit and stuff, you might be able to go back slightly sooner. I look forward to meeting you, Bevelyn, and I look forward to meeting you, Andina. The consultation fee will go towards your surgery costs if you book with me the day of your surgery. So if you get the consultation today and you're like, okay, I want to think about it, and then you call back in 3 months and you're like, okay, I'm ready to book, that doesn't come off. Because at the end of the day, I have to be paid for my time. Consulting with people and me not being paid. My office I still have to pay my staff to greet you, to take care of you. I got to pay people to answer the phones. I have to pay for the doors to open, the lights to be on. I just can't just be seeing consults all day and not make any income because I'm running a business. So My favorite surgery. I like tummy tucks a lot. But lately I've been having fun doing breasts. I've been doing more breasts than I normally. I used to do a ton of breasts. Like when I was in Indiana, I did breasts more than anything. But I took insurance in Indiana, so I did breast reductions a lot and breast reconstruction for cancer patients and stuff like that. And so I did a lot of breasts. I would say half of my practice was breast. Then when I moved to Atlanta, I started, and I didn't take insurance anymore. I didn't do breast reductions very often because people can get those covered by insurance, so they tend to choose doctors who take insurance, which is fine. I understand. And I focused so much on liposuction that I started to do so much liposuction, and then I forgot how fun breast is. So I've been doing breast more, and it's been a lot of fun. So I've been enjoying that. Yes, I can do reconstruction. You just have to pay for it. You can't get it with insurance. I'll fix someone else's work if you're out of the immediate post-op period. So you can't be like, I just had my surgery 6 weeks ago and I want you to fix it, because I'm not going to do anything at that point. Like you gotta be kind of out from the surgery. Lymphatic massages are very important for getting the best possible result with your liposuction. That's a good question, Janine. I probably should do a whole live video about my thoughts on recovery houses. Is recovering at a hotel just fine? Yes. Okay. So I think that recovery houses I think it's a wonderful concept. And in fact, when I was in med school, I had me and one of my girlfriends, we were talking about a situation where this is kind of before recovery houses were really a thing. We talked about having a place where people can go after surgery to just like recover and then come back home all good. And she actually ended up starting one because she ended up when medical school was over, she actually didn't do a residency. She decided not to do a residency, and she started a recovery practice. This was so many years ago. Like I graduated from med school in 2006, so she did that in like 2007. I think with the surge of plastic surgery tourism and people who normally wouldn't have been able to afford plastic surgery, but they're able to travel to other places and get surgery for lower costs, and they're looking for ways to cut the cost. And so some of these recovery houses are being used inappropriately. Like I don't think you should be in a recovery house if you're not appropriate to be at home. Like so if you're not appropriate to go home and have a friend or family member take care of you, you shouldn't be at a recovery house. It really should just be for convenience. It should not be to be like your nurse. If you are, I think some situations where people are running these plastic surgery factories, like, where they're rolling one woman out the room and rolling another woman in the other door of the same room, and then they shuffling over to the recovery house, and it's 5 and 6 girls staying in one room and they all laid up. Like that thing, that's not really, I don't know about that. Like I've heard some recovery house horror stories. But if it's a clean environment with appropriate patients there, not somebody who just got liposuction within an inch of their life or got 4 different surgeries, they got a tummy tuck and a breast lift and a breast augmentation and a BBL, and they lost a liter of blood, and they come in there looking like death and can barely stand up. They shouldn't be at a recovery house. They should be at a hospital. It shouldn't be. So if a person dies at a recovery house, it's not the recovery house's fault. It's the doctor's fault, because that person probably wasn't appropriate to be there. They should have been monitored at a hospital. So the answer to your question is yes, recovering in a hotel is just fine, because you shouldn't be in a recovery house if you're not appropriate to recover in a hotel, or if you're not appropriate to be at home. Problem is, people aren't using recovery houses that way. They're literally using them like they're an extension of the hospital, and they're sending these women there in really bad shape where they need to be monitored to make sure they're going to, be in a safe environment, make sure they don't need blood and stuff like that, make sure they're oxygenating okay, all of that stuff. When you've had a big, big, big surgery done to you, you shouldn't be going straight to a recovery house. I actually don't do it. I usually don't do more than 2 procedures in one day. I don't run a plastic surgery factory. I don't like operating for 12 and 14 hours a day. I don't like that. So I usually do 1. Sometimes I'll do 2 depending on what it is. Hey Sabrina. I love Botch too. What is the maximum number of liposuction surgery before you turn someone away? I don't understand. The number of surgeries that person may have had before I turn them away? Or the number of surgeries I would do in one day before I told somebody they couldn't get it that day or something? I don't understand your question, Kia. Massages, if you're in Georgia and I do surgery on you, you would get your lymphatic massages at my office. I don't know the places and where to go in other places. So when my patients travel to me from out of town, they have to find a place. They have to find a place where they live that will do their lymphatic massages. I used to be in Indiana. Yes, I was in Richmond, Indiana. I don't have a maximum number per se, but if the tissues are if it's all socked down, scarred down real bad, and they're trying to get more liposuction or something, then I would say no, probably. But Kimberly, you must be new to my videos, because everybody knows I talk a lot about that question. She said, I see a lot of girls going to Miami because it's cheaper, but a lot of doctors are not board certified. What are your thoughts on non-board certified doctors performing plastic surgery? I think that it is unethical, it is dangerous, it is bad, and I think it's both the patient and the doctor's fault. If you know a doctor is not a plastic surgeon and you go to them anyway, whatever happens to you, you were inviting it. That's what I think. I do not accept Care Credit. I accept Alpheon, United Medical Credit, and Lending USA, but I don't accept Care Credit. When you get a tummy tuck and you have loose skin, can working out help tone the stomach muscles and skin? Working out will help tone the stomach muscles. Working out will not help tone skin. It's safe to have a second tummy tuck, most likely. The muscle repair can be... Okay, so she said, is it safe to have a second tummy tuck 3 years later? I lost 35 pounds and my skin is sagging. And secondly, doctor, how likely is it that the muscle repair didn't take? Okay, if you have a tummy tuck, you shouldn't get the tummy tuck until you're within 10 to 15 pounds of your goal weight, so that what happened to her doesn't happen to you. Because if you go and lose a bunch of weight after the tummy tuck, you can end up with saggy skin again. Now, it's fine to get another tummy tuck as long as your tissues and stuff are all in good shape. So in general, the answer is yes, it's safe to get a second tummy tuck. How likely is it that the muscle repair didn't take? It's hard for me to answer that question because everybody repairs the muscles differently, use different types of sutures, have different techniques. If they did it the way I do it, it's not likely that the muscle repair won't take, because I have a 2-layer closure with interrupted and running sutures. Like, I literally do so much to make it so that it's almost impossible for you to lose your whole muscle repair. Now, there are ways that a person could repair it to make it so that if it gets damaged early in the post-op period, it could make you lose a result. But if one of the sutures like pops 6 or maybe 8 to 12 weeks out, perhaps you still can maintain your results. So I didn't answer that question real cut and dry because it's not a cut and dry answer. Is it best to get full lipo before tummy tuck in order to get the best results? That's how I tend to do it for most people. If I know they're going to need both, I'll do the liposuction first and then the tummy tuck so that things can be as tight as possible. Don't use drains for tummy tucks, Tara. I have a video called Drainless Tummy Tucks. In short, I believe you should use drains for tummy tucks. And I have reasons for that. It's not unethical or nothing like that to say to do drainless tummy tucks. It's not. It's a matter of opinion, and they're not wrong. But if you watch my video on drainless tummy tucks, you'll understand why I don't do those. Yes, girl. Kimberly, you should not be choosing your doctor based solely on the price. That's how people end up dead or disfigured. Yeah, that fascia blaster. First of all, fascia has nothing to do with the skin. Yeah, that's not got nothing to do with the skin. Exactly, Jessica. I'm located in Johns Creek, Georgia, which is a suburb outside of Atlanta. Toya, I can make a recommendation on what procedure you need once we've consulted and I've seen you. I can say that. I can answer that. I can't answer that without seeing what you look like. Oh, drains for lipo. I don't use drains for lipo. I thought you were talking about for tummy tucks. I don't use drains for lipo. The only time I'll put a drain in on a person who's had liposuction is if I do a BBL. I'll put a drain back there for BBL. But plain lipo, never. And I don't ever get seromas. Like literally, I have not had a patient get a seroma from liposuction ever. Like I legit can't think of one person that I've had that got a seroma. Like not one. The times that I've had people get a seroma was when I used to do breast reconstruction. I had a couple ladies get seromas with the tissue expanders in. I've had 1 or 2 seromas with tummy tucks. But never with liposuction. But you know what's funny? When I got liposuction, like when I had a person do liposuction on me, I got a seroma. A big one on my belly. I was pissed. And it made my result heel lopsided. Yeah, so my patients do leak. For the first 24 hours after surgery, they're a leaky mess. I leave the holes open and they leak. All the fluid drains out of the holes. And then after 24 hours, they take a shower, they're dry, and the leaking is over. And the holes close as soon as the leaking ends. And they don't have a drain. They don't get a seroma. It's awesome. When you put the compression garment on and the holes are open, it squeezes all the fluid out. It's so perfect. So they're just a little soppy for 24 hours. No, I do not list prices on my website. Absolutely not. You have to get a consultation because it's not, if it's going to take me 3 hours to do one person and 1 hour to do the other person, the two people, even if they're getting the exact same surgery, their price might not be the same because it takes more time to do, you know what I mean? Like I don't, it's based on the amount of time it's going to take me to do it and the amount of stuff you're getting done. It's just not cut and dry like that. So I don't post prices on my website. Everybody's saying, what is that? What do y'all mean? What is what? I do not snap my surgeries. I don't agree with that. I feel like when I'm doing surgery, I need to be focused on the person who's on the table, not entertaining people on Snapchat. So I don't do that. Sometimes I'll have the nurses record a short video of something I'm doing in the operating room, but it's not live. Like, I shouldn't be taking questions from y'all while I got somebody laying on the operating room table. I should be focused on the person that's laying on the table, not on rapping, dancing, and talking to y'all. If I was doing your surgery, you shouldn't want my attention to be on Snapchat. That's what I think. So I don't do that. Oh, hey, Mia. She right here. There she is. Is there currently a wait period for appointments for consultations? I can get people in pretty quick for a consultation. Because especially since I do a lot of awake lipo, I'm in my office, and even between, sometimes I'll have people's consultations scheduled while the person's numbing and stuff like that. So, like, I can usually get a person in for a consultation kind of quickly. I might be running late talking to you because I definitely, like, pack my schedule. Like, I'll have procedures and consults kind of like, I like optimize all of my time. So if I run behind on any part or on anything, it might make me be a little bit late. But my seroma made my lipo result a little bit lopsided because my surgeon was an hour away. I wasn't about to try to drain myself, so I never even got the thing drained. And I was so bad, y'all. I was like, you know what? The stuff that I talked about to make this video, I was that patient when I got my liposuction. Because when I got my liposuction, I didn't do a lot of liposuction. I did it sometimes, like it was like, you know, but now I do a ton of liposuction. And the past 3 years since I've been in Atlanta, I do so much liposuction. And the way I manage my patients post-op is different. And now, after having done so much of it the last 3 years, I see it's a clear difference between the people who get lymphatic massages, wear the compression garment like mad, you know, for the 3 months, watch their salt intake, keep their weight stable. Those ladies, their results come out way better than the people who wear the garment for 4 weeks or something like that and do whatever they want to do. And that's kind of what I did. Like, I probably stayed in my garment. I definitely wasn't in that garment for 3 months, not even close. I probably was in that garment for 3 or 4 weeks. Then I got a seroma, and I was looking at this big lopsided part where it was sticking all out. I had a big seroma. And then it eventually went down, but it's slightly bigger on the side that got the seroma. Like, I was my own worst nightmare. Like, I do the stuff that the patients who kind of lightweight drive me crazy not listening, I did the stuff that they do. So I guess it's like when you're bad when you're little and then you have a kid and they bad, how is God's way of getting you back? That's what's happening to me sometimes with my patients when they don't be wanting to listen. I didn't follow the rules because he didn't really give me no rules. And like I said, I didn't do a lot of liposuction back then. So I wasn't, you know, I'm like, oh, wear the garment for 3 or 4 weeks, whatever. It'll be fine. I was tripping. That was when I was like first out from training. Girl, yes, child. Put your garment back on, Angela. A seroma is a fluid collection under the skin that happens after surgery. It can happen after surgery. And that's the reason why with certain operations like tummy tucks, we put drains in to keep you from getting a seroma. And with liposuction, adequate compression can keep you from getting a seroma. Yeah. My office is called Adarabella Plastic Surgery. Let me type it in. Y'all hear Mila snoring? Her little butt snoring. She getting some rest because she didn't get any sleep last night. She was miserable. We had to sleep upright because She has so much like mucus, it was choking her. She was just crying all night, and literally she would take like 10-minute cat naps. I had to sit upright with her on my chest. It was miserable for me. So with my wake lipo, it's local anesthetic. So it's tumescent solution. So the person is wide awake. There's no anesthesiologist, because you're not losing consciousness in any way, shape, or form. And you're breathing for yourself and everything. It depends on, the drains come out when the drain is not putting out very much. So it's different for different people. When you were in medical school, how did you practice? On real people? Yes, on real people. So when you're in medical school, you are a part of the, you scrub into surgeries with a surgeon who's already trained and board certified and everything. And then they teach you stuff, and then they'll let you, when they think you are ready, they'll let you do stuff. They'll be like, here. You'll be sitting there retracting. Like when you first start out in med school, you just kind of like, when you're in surgery, you just retract. You're a human retractor. So what that means is, like, say I'm doing a tummy tuck and I need somebody to hold this tissue out the way so I can work right here. The med student is holding the tissue out the way. They just standing there holding it, just looking. And while you're standing there holding it, the surgeon, when we do this stuff called pimping, we call it pimping, and the surgeon will start randomly asking the med student questions, like about the anatomy or the physiology or the indications for the surgery or the complications or whatever. They'll start asking them questions for fun. Like, it's like a sport. Pimping is like what you do, like, to entertain yourself as a surgeon with the med students and the residents. You start asking them all kind of questions that you know they don't know the answers to, just to see them sweat. Well, if you actually know the answers to their questions, because there are certain questions they ask just to see if you even thought about preparing. Wow, I don't know why we're talking about this, but there are certain questions you ask that you expect them to know the answers to show that they actually prepared to come into this surgery. Like, you gave them the privilege of being able to scrub into this case with you, and the least they should do is do the basic reading about what's going on. And so if they don't answer those questions right, it's no good if you get those questions wrong. If you answer those questions really well, then the surgeon will step it up and ask something a little bit harder. You get those well, they'll ask more. If you can answer all the questions, then they're like, okay, you earned it. And then they'll be like, here, you can do that. They'll be like, here, they'll pass you the Bovie, or when they throw a stitch, they'll throw you the ends and let you tie it or something. And if you start fumbling when you tying it, they ain't gonna throw you no more stitches. So most med students are walking around with suture strings tied to their scrubs so they could just be practicing tying all the time. So when the surgeon throws you those strands of suture and say, tie this, you tie it well. If you can't tie it well, you might not get them thrown at you again for a while. So it kind of starts like that. It starts with little stuff. You're not going in there doing nobody's big surgery, like, and you haven't done anything. They start you off with little basic things. First, you got to be able to answer the questions. They need to see that you're really helpful first, just with everything that, beyond just doing the surgery. Then they'll give you a little bitty small task and see how you do with that. And then when you get that done, then they'll give you more. That's why the training is so long, because it takes a long time to go through the progression of going from holding the tissue to the side to go from there to doing a whole operation. It takes years. So nobody just lets you loose as a med student on a patient all by yourself. That never happens. Where's the comments? Oh, Mila just hit the screen and moved I was like, where'd the words go? Mia, great question. She said, has anybody passed out in school? Okay, so the first time that I was in the OR, I almost passed out. The room started turning white. I was about to faint, and I'm like, they were like, oh God, she's about to go down. And the nurses will sit you down on the stool and put cool towels on your forehead and on your neck. And sometimes you got to leave out of the room and take all of the stuff off, like the mask and the gown and stuff, because you overheat. And it's just overwhelmed from the smells, the way it smells. Like when we're bovian the tissue, like you can smell the flesh. That gets to people. Being trapped up in that mask, seeing stuff that you haven't ever seen before. All that stuff kind of gets to people. So it's very common for people to pass out on their the first few times that they operate. The other times that I almost passed out was when I was pregnant. So, that kind of gave me an inkling that I might be pregnant when I was like about to pass out under my mask. And I'm like, ugh. I remember when I was pregnant with Bradley, I was like, why am I fainting? Why am I about to faint? And when I was pregnant with Bennett, I was still in residency. It was my last year of residency when I was pregnant with Bennett. And I remember I kept being about to faint in this one case. And my attending was like, are you pregnant? Because pregnant ladies be about to pass out. With all that stuff on, you just get hot. Them smells, just all that stuff. You just like can't take it. So yes, it happens to people. Sometimes they do pass out. Mercy Amada, a waist trainer is not a good idea right after liposuction. You can kill your tissues. I don't recommend waist trainers right after lipo. I don't allow my patients to use waist trainers until 4 weeks out. Surgeons are mean, yeah. It's fun pimping med students. It wasn't fun when I was a med student, but then when I got med students, I love pimping them. I'm like, you don't know what? Why are you in here? And surgeons, when you're being trained in medical school, it's not like all these, it's almost like the HR department doesn't exist for medical training. The surgeons can talk to you any kind of way. They can throw you out. They can call you stupid. They can cuss you out. They can whatever. And, nobody cares. They don't be like, he called me. They'll be like, what are you, fucking stupid? Like, they'll say stuff like that. Like, I've had people say that to me before when I was in residency. Or med school. No, not med school, in residency. General surgeons are mean, and they are aggressive in the operating room. And you get to whine and act like a baby or go try to tattletale on somebody, it just makes your life way more miserable. It's a boys' club, and they don't care. So, surgeons are very mean. And then people wonder why women surgeons are so mean. It's because you go through worse stuff. When I was pregnant with Bennett, like my OB had to write a note to my residency program saying she can't be in 12-hour surgeries. Like, I would be in surgery, one person surgery for 12, 14 hours, pregnant. Couldn't eat. Like, no, it's not racism. It's what they do to everybody. They do it to everybody, no matter what color you are. Like, it's just what it is. It ain't got nothing to do with race. They said it to everybody. They call everybody stupid. That's just what it is. It's not a race thing. But it's just you want your surgeon to be able to handle pressure. You want your surgeon to be able to think quickly on their feet in a serious situation. If the patient's status changes quickly and abruptly in the case, you don't need somebody that's like a pansy. Like, you need somebody that's aggressive and sure and smart and that has instincts. And instincts are created by doing things over and over and over again well, teaching other people, doing it with your eyes closed. So part of like training, like, I would go sometime. I think the longest I ever was working without sleep was 40 hours. Like, I literally worked for 40 straight hours. And you still need to be able to make a decision, an important life or death decision, even when you're tired. So I think that's part of why our training is like that, so that you can think quickly. And you don't think quickly if, like, you need the pressure put on you when it's not really that much pressure first. You don't want to be just thrown into a pressure situation and you don't know how to handle it. So surgeons create pressure for the trainees. So that way when they are in real pressure, they're not pressured by it. If that makes sense. Does that make sense? So that's just the culture. But that's why surgeons are badass. Like, we can do a lot of stuff. Tell you, and stuff changes when the climate changes in the OR from like maybe a patient's going south or stuff is going, like, a surgeon can think quickly on how to turn the situation around. Think quickly about what could be happening to make this be going like this. That's the training. And you need to be like that. So, yeah, it's not a race thing. Yeah, they run. Like, and interns and residents are good. Like, people always think, folks kill me. They'll be like, people will put on my videos like, what do you feel about people getting surgery from a resident clinic? But then they're like, if you're getting surgery from a plastic surgery resident, you're going to be in pretty good hands 9 times out of 10. First of all, the resident clinics don't start until the person, at least when I was in training, all the resident clinics that I knew about in the different programs, only the chief residents got to do that. So that's a person who's about done with residency. They know how to do surgery. They know how to do everything. They've been training in plastic surgery. They've been doing plastic surgery day in and day out for years. They won't go to that doctor, but then they'll go to like a family practice doctor that's doing plastic surgery. Like, that makes no sense. But he's board certified in family medicine. He ain't no dang on surgeon. I would get a resident plastic surgeon over a family practice doctor doing plastic surgery any day. Any day. And residents, they know so much. Like, the stuff that I don't practice in plastic surgery, like, I'm not as sharp on that stuff as I was when I was in residency. In residency, residents are sharp on everything. You have to know everything. Like, everything. Residents are sharp. When you go into the hospital, when people do stuff like, I don't want no resident, or I just want you're setting yourself up for trouble, especially if you're in a hospital that has residents. Like, 9 times out of 10, it's better to let people do stuff the way they normally do it in those academic places. When you start saying, I don't want a resident, or I don't want a med student in my room, and all that other stuff, you mess up their normal protocol of how they do stuff. Those attendings, the board certified ones, they don't do certain things when they're working in the hospital setting, because that's what the residents or the med students do. So then when you go and ask this doctor who hasn't done this type of procedure in 20 years to do it because they're the attending, but the resident does 5 or 6 of them a day for the last 4 years, it's better to let the resident do what they normally do. So residents know a lot. I've done surgery on my mother. I did lipo on my mother. I did lipo on my husband. I wouldn't take my mom to surgery, like, if she had to be put to sleep, though. Like, she was awake for the lipo. But, like, if she wanted, like, a breast surgery or something like that where she's, like, being put to sleep, I would probably get one of my colleagues to do it. All right, y'all, it's getting late. I think I'm going to go ahead and get off. We talked about all kind of stuff tonight, huh? Myla Rose came through. I thought it was going to be short because she started off a little sketchy. Okay. So anyway, I am Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.adarabella.com, or you can call my office at 678-325-0006. And I will talk to y'all later. Bye.